Hi, my name is John Tenorio, and this is a video for Medical English. I'm going to share the topic of progress in primary biliary cholangitis. So, definition. Primary biliary cholangitis, or PBC, previously known as primary biliary cirrhosis, is an autoimmune disease of the liver. It results from a slow progressive destruction of the small bile ducts of the liver, causing bile and other toxins to leak into the liver and produce a condition called cholestasis.
Primary sclerosing cholangitis is a condition where the intrahepatic and the extrahepatic ducts become strictured and fibrotic. So if we look at the name, sclerosis means stiffening or hardening, and cholangitis refers to inflammation of the bile ducts. So this is stiffening and hardening of the bile ducts and inflammation of the bile ducts. And remember that the bile ducts are responsible for taking the bile that's produced in the liver down that small tube that we call the duct and into the intestines. When we talk about strictures, we mean narrowing, and when we talk about fibrosis, we mean hardening. So this narrowing and hardening of the bile ducts causes an obstruction to the flow of bile out of the liver and into the intestines. Now, chronic obstruction of bile eventually leads to a back pressure of bile into the liver, causing liver inflammation, which we call hepatitis, which leads on to fibrosis of the liver tissue, and then ultimately liver cirrhosis. The cause is mostly unclear, although there's probably a combination of genetic, autoimmune, intestinal microbiome, and environmental factors. And we know there's a well-established link between ulcerative colitis and primary sclerosing cholangitis. And this is quite a common question in the exams. So if you spot a patient who has ulcerative colitis in your exams, and they start to have liver symptoms and signs, think about primary sclerosing cholangitis. In fact, about 70% of cases of primary sclerosing cholangitis are associated with already established ulcerative colitis. So what are the risk factors? Well, the common patient that you'll see coming up in your exams is a male patient aged between 30 and 40 years old who already has ulcerative colitis and may even have a family history of primary sclerosing cholangitis.
Most applications in medicine. Most patients are diagnosed when asymptomatic, having been referred to the hepatologist for abnormal liver function test, mostly raised GGT or alkaline phosphatase, performed for annual screening blood test. The therapy of PBC targets disease progression and symptom control. The first-line treatment for PBC is ursodeoxycholic acid, or UDCA. UDCA improves liver enzyme levels, slow down the histological progression, and improve liver transplant-free survival.
Primary biliary cholangitis and cirrhosis, sometimes just shortened to PBC, is this autoimmune disease where the T cells attack the cells that line the smaller sized bile ducts in the liver. As the cells are damaged or destroyed by immune attack, they start letting bile leak through their tight junctions and into the interstitial space, where it can get into the blood and other liver cells. This can cause inflammation and symptoms that are similar to cholestasis and obstructive jaundice, both of which there's this disturbance in bile flow. At first it presents as chronic inflammation, which is where it gets the name cholangitis, for inflammation of the bile ducts. But advanced stages of the disease leads to cirrhosis as more cells are destroyed, both from the autoimmune attack and from infiltration of bile. As with a ton of autoimmune diseases, the exact reason why these T cells start attacking these bile duct cells is unknown, and it's likely related to genetic predisposition in combination with environmental triggers, and is associated with other autoimmune diseases like autoimmune hepatitis and Sjogren's syndrome. And PBC tends to affect women at a much higher rate than men, at about a 9-to-1 female-to-male ratio. For some reason,
Pros and cons. Pros. The UDC acid improves the condition of the pathology, reduces the degeneration of the tissue. The PBC it is a very disease to diagnose. Cons. The PBC has a short life expectancy, which may be worse with decompensations. The reason behind the etiology are still unknown. The diagnosis of the disease can be delayed because patients tend to be asymptomatic in the initial stage of the disease.
Primary biliary cirrhosis, or PBC, is the topic for this video. And PBC is essentially an autoimmune disease that affects the liver. And the primary pathophysiological problem is that the bile ducts are being destroyed. This disorder, 95% of the time, involves women, and most clinical vignettes will label an age of about 35 to 70. Now, what's happening in terms of the etiology is that the T cells are attacking the bile ducts. And over time, what happens is this leads to impaired bile formation and impaired bile secretion. Now think about that for a second. If you have impaired bile secretion, that means that the bile is not flowing out like it should, so it stays where it is, and that leads to cholestasis. And the cholestasis is the main problem that causes all the symptomatology. What happens when the bile doesn't move and stays in one place is you get these retained toxic metabolites. And these toxic materials damage the liver cells. And that essentially is what leads to liver inflammation and eventual cirrhosis. So that is, in a nutshell, the etiology and pathophysiology of PBC.
Issue applied in Ecuador. In Ecuador, it is a rare disease affecting 20 out of every 100,000 inhabitants. It is more frequent in the female population with a 9 to 1 ratio. Conclusion. The primary biliary cholangitis is an uncommon disease, and due to the symptomatic clinic, it is necessary to run blood tests every year to improve the condition of the liver, and if it is required, start with a treatment. Thanks.